Hi, welcome to the Gayle M. Jacob Cancer Center. I'm Saya Olivier, the clinical nurse manager at the Hematology Oncology Clinic here. I've been at Allegiance for 7 years and I'd like to show you around. So come on in. This is our reception area where patients will be greeted by Christy and Sandy, welcoming them to the Gayle M. Jacobs Cancer Center. And this is our reception area. We still have a couple of projects in the works. We're going to be getting a lovely water feature in January. So come on down. Our patients will be able to check out with schedulers. We have frosted doors for the privacy of our patients as they check out and make schedules. This is our lab where our patients come in the morning and they get their lab work done before they come and see our providers and then go on to our infusion room. We had 8 exam rooms and we now have 15. We've expanded the size of the rooms to meet the needs of our patients. Some of our patients are in wheelchairs or walkers, and so we've made the rooms easier for them to maneuver in and out. We too have 2 nurses stations at the end of the hallway to assist our providers with any needs they have for our patients. And you can see our lovely water feature that we have for our patients to enjoy while they're receiving chemo. The chairs can face the water feature and garden area, or they can turn them to the TV if that's what they prefer. And welcome to our infusion room. When our patients come down, they're greeted by a volunteer here who will help them to their assigned seats. And our lovely nurses, Natalie, Antigone, Lydia, and Christy. In each chair area, our patients have their own lighting system where we can dim it or make it brighter depending on what the patient would like. We also have a heating system in the ceiling to adjust the heat in the area for the patient for their comfort. Our patients also can turn their chairs to either sit more to face the waterfall in the garden area, or of course they can turn and watch the TV if that's what they prefer. Our patients also have curtains if they prefer privacy. We can pull the curtains around to offer them that.
Hi, I'm Leslie Thompson, the nurse practitioner here at the Allegiance Osteoporosis and Balance Center, and I'm looking forward to giving you a tour. I've been with the hospital for 21 years and looking forward to showing you around, so follow me. First off, I'd like to show you our apartment, or a mock-up of an apartment. We use this area primarily for physical therapy and occupational therapy for our patients. Osteoporosis patients and balance patients, some of the time, are the same patient. We want to make sure people are able to maintain their functional ability in a realistic setting. So therapists can work with patients in here for safe functional movement and helping them to prevent a fall in the future or a fracture in the future. Our DEXA scanner is the machine that we use to determine a patient's bone density. It's our new GE Lunar DEXA scanner, state-of-the-art, along with Kathy, who does most of our DEXA scans. It's really important that we have a very small group of people who do the DEXA scans because it's very operator dependent on positioning for the patients for the accuracy of the exam. We have 3 exam rooms used for workup and treatment. In here you'll see our rotary chair used by our audiologists. Our audiologists come over to the center and place a patient in the chair. Contrary to how it may look, the chair does not spin, but it does a series of rotation and monitors eye movement. It gives the audiologist some information on the source of the patient's imbalance, whether it's vestibular inner ear or a central source. In this room, we have what's called computerized dynamic posturography. And it's also used for determination of treatment. Our physical therapists, occupational therapists are trained on using this machine. The platform on the bottom will pulse forward, pulse backwards. The patient is put into a harness and hooked to the frame so that we don't have any issues with falls. The horizon in the back will move backwards and forwards, helps to determine where the source of the patient's imbalance is once again, whether it's a somatosensory problem, a pure musculoskeletal problem, whether it's a visual ocular type problem. So it's for gathering data and making personalized treatment plans for our patients. Thank you for coming to visit Allegiance's new Osteoporosis and Balance Center. Have a great day.